Hello dear students, today we will discuss on antihypertensive. So let us start with the hypertension. Etiology of hypertension: a specific cause of hypertension established in only 10 to 15% of the patient. Patients in whom no specific cause of hypertension are said to have essential or primary hypertension. Patients with a specific etiology are said to have secondary hypertension, and genetic factor, physiological stress, and environmental and dietary factors as contributing to the development of hypertension. The heritability of essential hypertension is estimated to be about 30%. This slide shows classification of hypertension on the basis of blood pressure. Again, there are two types. There is a systolic as well as diastolic pressure, of Hg category wise. So normal blood pressure of a person is calculated as 120 and 80. 120, that is a systolic, and 80 is of diastolic pressure. The person is considered as a normal person. 120 to 150 or 150 to 80 is considered or pre-hypertension. More than 140 and 90 is considered hypertension, and 140 to 159 oblique 90 to 90% is considered as stage 1 hypertension. More than 160 and 100 of diastolic pressure is considered as stage 2 hypertension. Now, normal regulation of blood pressure. According to the hydrolytic equation, arterial blood pressure is directly proportionate to the product of blood flow, that is the cardiac output CO, and the resistance to passage of blood through precapillary arterioles, peripheral vascular resistance, that is the PVR, into blood pressure is equal to cardiac output and peripheral vascular resistance. Blood pressure is maintained by first moment to moment regulation of cardiac output and peripheral vascular resistance exerted at 3 atomic sites arterioles, post capillary venule, that is the capacitance vessel and heart. Next is the kidney and baroreflexes mediated by autonomic nerve, that is the combination with humoral mechanism including the renin-angiotensin aldosterone system, local release of vasoactive substances. Now let us discuss on antihypertensive agent. Variety of antihypertensive agents are available which are prescribed according to the severity, age, sex of the patient. So let us start with the diuretics. An important antihypertensive agent includes thiazide, hydrochlorothiazide, chlorthalidone, indapamide, and high-ceiling diuretics are the furosemide and toracimide. Ethacryonic acid, that is the potassium-sparing spironolactone amylorides. Angiotensin-converting inhibitors, that is the captopril, enalapril, lisinopril, perindopril, ramipril, and fosinopril, etc. Angiotensin, that is the AT1 receptor blockers, includes losartan, candesartan, etc. Direct renin inhibitors includes aliskiren, and beta-adrenergic blocker includes propranolol, metoprolol, as well as atenolol. Continues this series. Again, calcium channel blockers play an important role as antihypertensive agents, which includes verapamil, diltiazem, nifedipine, amlodipine, etc. Beta-alpha adrenergic blockers includes labetalol and carvedilol. Alpha-adrenergic blockers, prazosin, terazosin, and phenoxybenzamide, etc. Again, central sympatholytics includes clonidine as well as methyl dopa. Vasodilators, variety of vasodilators are available. Vasodilators, arteriolar, that is the hydralazine and minoxidil diazoxide, arteriolar plus venous, that is the sodium nitroprusside. Other antihypertensive agents are also available, which are very important. That is the adrenergic neuron blockers, reserpine and guanethidine, and ganglionic blockers, that is the pantolinium, etc. This slide shows site of action of the major classes of antihypertensive. As we have already discussed, there are various sites are available and they are effectively work. Now, treatment of hypertension. Hypertension is curable and it is controlled by taking the proper medicines. Vasodilators and some are how not prescribed. For example, hydralazine, dihydrolazine and minoxidil are not used as primary drugs to treat hypertension. These vasodilators act by producing relaxation of vascular smooth muscle primarily in arteries and arterioles. This results in decreased peripheral resistance. Both agents produces reflex stimulation of the heart, resulting in the competing reflexes of increased myocardial contractility, heart rate, and oxygen consumption. Hydralazine is an accepted medication for controlling blood pressure in pregnancy-induced hypertension. This drug is used topically to treat male pattern baldness. Continuation with that, hypertensive emergency, it is rare but life-threatening condition. Systolic BP, that is a 180 mm of Hg, or diastolic BP more than 120 mm of Hg with evidence of impending or progressive target organ damage such as stroke as well as the MI, myocardial infarction. A variety of medications are used including calcium channel blocker, that is the nicardipine and clevidipine, nitric oxide vasodilators, and adrenergic receptor antagonists, that is the esmolol and labetalol, etc. The vasodilator hydralazine and the dopamine agonist phenol-dopam. Now let us discuss on resistant hypertension. It is defined as blood pressure that remains elevated despite administration of an optimal 3-drug regimen that includes a diuretic. The most common causes of resistant hypertension: poor compliance, excessive ethanol intake, and concomitant conditions like diabetes, obesity, sleep apnea, and hyperaldosteronism. High salt intake, that is a metabolic syndrome, and component medications that are the sympathomimetics, non-steroidal anti-inflammatory or antidepressant medications, insufficient dose drug and combination. Summary of World Health Organization and Health Minister of India and British Hypertension Society, that is BHS 2004 guidelines, except for stage 2 hypertension, start with the single most appropriate drug, followed by ABCD rule. A includes the S inhibitors, and B beta blockers, C CCB, and D diuretics. While A and B are preferred in younger patients less than 55 years of age, or are preferred in the older more than 55 years of age for the step 1 or monotherapy. Initiate therapy at low dose. If needed, increase dose moderately. If only partial response is obtained, add a drug from another complementary class or change to low dose combinations. Summary of WHO, ISH and British Hypertension Society 2004 guidelines. If no response, change to a drug from another class or low dose combination from other classes. In case of side effects to the initially chosen drug, either substitute with drug or another class of reduced dose. Majority of stage 2 hypertensives are started on a 2-drug combination. Dear friends, this slide show lifestyle modification, and that is the initial drug choice without compelling indications, and with compelling indications, that is the stage 1, stage 2, stage and drug for the compelling indications already. Combinations of antihypertensive that should be avoided. There are various conditions where antihypertensives should be avoided, like combination possible effect an alpha or beta-adrenergic blocker with clonidine apparent antagonism of clonidine action has been observed. Hydralazine with dihydropyridine, that is a DHP, or prazosin hemodynamic action, verapamil or diltiazem with beta blocker bradycardia, AV block and methyl dopa with clonidine, or two drugs of the same class. Again, continuation with series. That is a possible combination of antihypertensive drugs, continuous green line preferred combinations, dotted green line acceptable combination, and dotted black line, that is a less usual combination. Red line indicates unusual combination of antihypertensive agents. So dear friends, this is all about the antihypertensive agents, and already we have discussed about the hypertension. It is cured and controlled by taking the proper exercise, proper medicine, and by controlling of the person affected. Thank you for your listening. Thank you.